Doxepin, tertiary amine tricyclic antidepressant. The capsules and the oral concentrate used for the treatment of anxiety and as an adjunct to
Antimaniac.
agents in the treatment of depressive episodes associated with bipolar disorder. The tablet form can be used for the treatment of insomnia characterized by difficulty with sleep maintenance. The capsule and oral concentrate is used for the treatment of depression, including psychotic depression. We should also notice that when discontinuing antidepressant treatment that has lasted for more than 4 weeks, we should gradually taper the dose over 2 to 4 weeks. For example, over 2 to 4 weeks to minimize withdrawal symptoms and detect re-emerging symptoms. For brief treatment, such as 2 to 3 weeks, may taper over 1 to 2 weeks, and for less than 2 weeks treatment doesn't warrant tapering. The reasons for a slower taper, such as, for example, over 4 weeks, include history of antidepressant withdrawal symptoms or high doses of antidepressants. If intolerable withdrawal symptoms occur, resume the previously prescribed dose and or decrease dose at a more gradual rate. Selected patients, such as those with a history of discontinuation syndrome or long-term treatment more than 6 months, may benefit from tapering over 3 months. And when it comes to switching antidepressants, the evidence for ideal antidepressant switching strategies is limited. Strategies include cross titration, gradual discontinuing the first antidepressant, while at the same time gradually increasing the new antidepressant, and direct switch, abruptly discontinuing the first antidepressant and then starting the new antidepressant at an equivalent dose or lower dose and increasing it gradually. Cross titration, such as over 1 to 4 weeks, depending upon sensitivity to discontinuation symptoms and adverse effects, is standard for most switches but is contraindicated when switching to or from monoamine oxidase inhibitor. A direct switch may be an appropriate approach when switching to another agent in the same or similar class, such as when switching between two selective serotonin reuptake inhibitors. When the antidepressants to be discontinued has been used for less than 1 week, or when the discontinuation is for adverse effects, when choosing the switch strategy, consider the risk of discontinuation symptoms, potential for drug interactions, other antidepressant properties such as half-life, adverse effects, pharmacodynamics, and the degree of symptoms control desired. Switching to or from an monoamine oxidase inhibitor allow 14 days to elapse between discontinuing an monoamine oxidase inhibitor and the initiation of Doxepin. Allow 14 days to elapse between discontinuing Doxepin and the initiation of an monoamine oxidase inhibitor. US vaccine warning: antidepressants increased the risk compared to placebo of suicidal thinking and behavior in children, adolescents, and young adults in short-term studies of major depressive disorder and other psychiatric disorder. Anyone considering the use of Doxepin or any other antidepressants in a child, adolescent, or young adult must balance this risk with the clinical need. Short-term studies didn't show an increase in the risk of suicidality with antidepressants compared to placebo in adults who are more than 24 years of age. There was a reduction in risk with antidepressants compared to placebo in adults 65 years of age and older. Mechanism of action: increases the synaptic concentration of serotonin and norepinephrine in the central nervous system by inhibition of their reuptake by presynaptic neuronal membrane, and antagonizes the histamine H1 receptor for sleep maintenance. The efficacy of Doxepin in the off-label use of chronic urticaria is believed to be related to its potent H1 and H2 receptor antagonist activity. Onset of action: for depression, initial effects may be observed within 1 to 2 weeks of treatment, with continued improvements through 4 to 6 weeks. Volume of distribution is 20.2 liter per kilogram. Protein binding is 80%. Metabolism through hepatic via cytochrome B2C19 and 2D6. 27% bioavailability. Half-life elimination in adults: Doxepin 15 hours. N-dis-methyl Doxepin 31 to 51 hours. Time to beat: fasting time to beat for the tablet form is 3.5 hours. Excretion mainly through urine. Primary metabolite is N-dis-methyl Doxepin. FDA approval date is March 11th, 1974.